Interestingly enough, most of the cell therapy-based stuff that I'm going to be talking about in the context of preventing relapse post-transplant are the studies that do not include myelofibrosis at this time. But that is the hope and the opportunity that I want to leave the audience with. So there are several exciting concepts that are being explored in the context of heme malignancies in general, in myeloid neoplasms, and some of them even include MDS-MPN overlaps. So one of them is something that we're doing in collaboration with Children's National Hospital to use tumor-associated antigen-targeting T-cells derived from the donor. So here we're targeting WT1, PARMA, and survivin. And these cells are derived from the donor. They're expanded. They're exposed to the library or peptide libraries. They're expanded and then infused back into the transplant recipient. In a preemptive setting, we've seen meaningful remissions, which are lasting over a year in a majority of patients. But that data is building. It's an ongoing study. The second study, or the second concept that I'll allude to, is being developed by T-Scan Therapeutics. So this is, again, a donor-derived product which targets lineage-specific antigens HA1 and HA2, which are present specifically on hematopoietic cells. And here you're using the advantage of the intolerance of the donor T-cells to these antigens, because in the donor, these antigens are absent. So you select your donor accordingly, or you select the combination accordingly. And then you infuse them into the patient, into the recipient, about a month following transplant. And so far, again, similar results, earlier results, but so far in patients with high-risk malignancies, there have been ongoing complete remissions, some even over a year in these patients who usually tend to relapse within a year or at about 6 months. And the third concept in that regard is gamma delta T cells that is being developed by a company called InnatBio. And again, gamma delta T cells are a subset of T cells which are responsible for responding to infection, to malignancy cells, and they can cause cell killing without cell processing, and they don't need MHC representation. And again, in this concept, what InnatBio is doing is using donor-derived gamma delta T cells, expanding them and activating them and infusing them back into the recipient, again after engraftment, which is about a month following transplant, with good initial results from a single center study so far, and they're trying to expand their data. So those are some of the things that are concepts that are available out there to be or yet to be explored in MPNs. As always, MPNs is a wicked stepchild in terms of progress. So these concepts are slow to get there, but hopefully we'll be able to get them to the MPN field as well.